Welcome back to Good Day State Line. We are hanging out at Dreier Family Dental again with Dr. Dreier and Kara. Hi guys.
Hi.
Hello. Thanks for having us. Tonight I know we want to talk about CPAP machines and what's been going on with them, so we got to know what a CPAP machine is.
Yeah, of course. So last time we were talking about sleep apnea and treatment options that are available. We want to talk about kind of the conventional treatment that there always has been, and that is CPAP. Continuous positive air pressure is what that stands for. I know everybody's kind of seen one of those masks or know somebody that uses one of those. It's a mask that goes on your face. There's the hose that goes down to the machine, and it is continually pumping air into your lungs to inflate your body, so you're breathing well, having oxygen throughout the course of the night. So that's kind of the conventional treatment and what people are having affected now because of the recall.
Yeah, so tell us a little bit about the recall.
Yeah, so back in July of 2021, there was a large CPAP recall affecting the users of the Philips brand. So there is two main CPAP makers, Philips and ResMed, and Philips had the huge recall, and what's happening with that is in the machine, the foam is breaking down and degrading, releasing toxic gases and the foam particles that the patients are now breathing. And so that's affecting a lot of the users who previously had one, or new patients trying to get one are being on a waiting list.
So obviously that can create a problem.
Yes.
Right? Because we talked about how sleep apnea is really, really serious, and so not being able to treat it with the conventional treatment means you got to turn to something else.
Absolutely.
So tell us what that is.
Yeah, so the next treatment that, the treatment that we offer here at our office is what's called oral appliance therapy. Basically, it's a mouth guard, if you will, that helps bring the lower jaw forward, which brings the tongue forward as well, and then keeps the airway open so the patient is able to breathe on their own without having to be, strapped to a machine and plugged into the wall.
Yeah, well, even just looking at the two things right here, I mean, I would pick that one.
You pick this, right?
Yeah, and we do have a lot of patients that do use the oral appliance for traveling and things like that instead of using the CPAP machine. It can just be more convenient, not having to check it and things like that. So.
And that's newer, not just to you, but to everyone, right?
Yeah, absolutely. It's been around for a while. I mean, it's not a new treatment, but it's definitely coming more into play now because of the recall. Yeah. Now, that being said, the most severe cases of sleep apnea, an oral appliance may not be the appropriate treatment. So that's where CPAP definitely still has its place in treatment of sleep apnea, and that's going to be those more severe cases. But for those patients that are in the mild to moderate range, an oral appliance is a really great option.
Yeah, or patients who have had CPAP therapy and they just can't tolerate it. I mean, you find so many patients who do try the CPAP and it works great for them, but then there's the patients who try it and they just can't wear it, so.
Is the oral therapy treatment something that you would only find at a dentist?
Yeah, so dentists definitely do make these appliances. They are, sleep physicians are starting to get more in understanding that an oral appliance is a great option as well, where previously it was mainly just pushing CPAP and BiPAP as well. But yes, an oral appliance is definitely something that your dentist is going to help you get because of it being with the oral cavities, making something fit your mouth and fit comfortably. And so find somebody that'll be able to help you with that.
Also, it's a little more personalized.
Absolutely, it is perfect. I mean, it's fit perfectly just for the patient. So it's scanned. We have a digital scanner that makes a perfect 3D copy of your mouth, and so the appliance will fit you and just you.
So if somebody thinks this might be for me, how do they get everything started?
Yeah, so they would definitely contact us. That way we could set them up to even take the sleep study, and then if we find they have it and it is something that we are going to treat them for, we will use our digital scanner to take those impressions, get that off to the lab, and get it fitted for them.
Awesome. So how do we get in contact with you then?
Yeah, so Southern Wisconsin Sleep Solutions is our entity that we're doing our oral appliances through. You can find us online, or you can also find us at Janesville Family Dentist, and that's our main page.